So this is a really important session. So you probably all followed the COP26 health program, or now it's called ATTACH. And it's really good to see the number of countries now, signing up to embrace this idea of low carbon healthcare systems. So I was on the website a few days ago, so on the last count, I think it was 68 nations around the world that have signed up to this idea, and there are 10 of them in Europe. So the UK, Germany, Ireland, the Netherlands, and in Eastern Europe, I think only Poland is the only one there. So this is a great topic, and we've got a great bunch of panelists today. So let's get started. So Will, I'm going to start with you. Mm-hmm. So reducing Scope 1 and 2 emissions in the European hospital sector, can you set the scene for us? How well is that going? And where is it moving?
Okay. So in 2019, our organisation published what was at the time the most comprehensive study of emissions from healthcare, and that showed that globally, healthcare is responsible for just under, it's now about 5% of emissions. So to put that into context, if healthcare were a country, it would be the fifth largest emitter in the world. It's a really big deal. The EU 27 represent about 12% of that. Healthcare is about 10% of GDP in Europe. So it's a sector that we think has a big responsibility and a big role to play in decarbonising our economies. Scope, so broad brush terms, that the footprint, if you break it down, about a third of it, about 20% roughly is sort of buildings, so in energy use, that kind of thing, so it's emissions from buildings. About 20% is travel, and then the rest of it, sort of 2/3, is procurement, so it's sort of supply chain, Scope 3, and I know we'll come on to that. Now, most of the work that's been done, in Europe certainly, and I'd say globally, on decarbonising healthcare has been done in that sort of Scope 1 and 2 area. So that's sort of looking at, how can you decarbonise buildings? It's things like lighting, it's boilers, it's using more efficient technology, it's reducing fossil fuel use on site and electricity. There's some, active travel stuff that's kind of emerged as well. A lot of the focus now is moving towards Scope 3, because that's kind of the elephant in the room. But also really interesting stuff, like another sort of overlooked Scope 1 emission source is anaesthetic gases. And there's been huge amounts of work done, particularly in the UK now, on this. Scotland was the first country in the world to phase out desflurane, which is a hugely impactful anaesthetic gas from a greenhouse gas impact perspective. Nitrous oxide. So, things are really happening. Things are really starting to take off, but that has been where most of the focus has been so far.
Yeah, I'm so glad you mentioned desflurane, and it'd be good to see in later sessions what other countries are doing on that front. To what extent do you think hospitals have a really good baseline of their greenhouse gas emissions, in terms of what that number is across Europe, and who's kind of ahead of the game?
Well, the NHS has done a lot on that. I worked in the NHS. I was working in the NHS 10 years ago. So there's a track record. There's a history of doing this in the NHS. But countries all across Europe are now doing this. There are lots of tools available. We have a tool, I think, called the Climate Impact Checkup tool, which allows any hospital to measure their carbon emissions. There are national level calculators that are being developed. So the kind of the know-how and the wherewithal to do this is really sort of taking off. I would say, though, that our network numbers about 7,000 hospitals and care providers across Europe now. So it's a kind of growing. We're seeing this growing momentum across Europe. Hospitals wanting to do this more, and that is the starting point. It's measuring their baseline, and there's not, I think there's not a lot of the skills to the tools are there. The skills to do it need to be developed. So I still think there's work to do for sure.
Excellent. We'll come back to you anyway on this, but let's go to Mark. Mark, now considering Scope 3 makes up a great chunk of greenhouse gases in the healthcare sector, so how have companies like Philips or just the industry working, with the NHS or other healthcare organisations in Europe, to reduce that? And what's the experience been like, with your own experience, say, with the NHS?
Okay, yeah, so thank you very much. So, Will's just described me as the elephant in the room, so I've got to live up to that. So I'm here talking, again, as Philips, but again, representing industry, and really this Scope 3 topic is really important. So, again, when we think of the NHS, 4% emissions, Scope 3 is 62% of that. So if healthcare systems don't work with industry, we cannot address this Scope 3, and that Scope 3 is everything from supply, manufacture, medicine delivery, construction, all of those topics which are extremely important. So it's an incredibly important topic, and I hope I can talk with some confidence today as Philips. We've been operating as a net zero manufacturer for many years. So rather than sell my company and my stories to you, but more to tell you some examples of what we've done and why I think it's extremely important and why industry, I believe, needs to be held more to account for making a bigger contribution to the net zero position. So, and again, we look at it very much as a company in kind of three areas. So one is, how do we get to net zero manufacturing? The second one is, how do we scale and speed up digital transformation and all of the benefits that brings in terms of the sustainability benefits as a kind of a side part. And the third one is the cultural embedding of sustainability within us as an organisation, and then in the UK working with the NHS. How do you create those connections and that community that want to work together to really make this part of the foundation? So I can give you some examples. So in terms of manufacturing, for us, it's always been about how do you get to a net zero position on actually manufacturing products. So making sure the factories are fully net zero, renewable energy, nothing goes to landfill. We work with, we put a big pressure on our supply chain. So those companies that then provide us the raw materials, the freight, the transport, all of those, that they also have to have a very strong carbon reduction plan. And that if we work in that journey, the products that we then bring to market to the health systems are by their very nature more sustainable than the ones they're replacing. So that's from a manufacturing. Within that then, it's about eco-design. And that's all about how do you make products that are replacing something that is 15 years old, significantly more carbon neutral than it used to be. And we have great examples with things like MR. MRI machines, there's about 500 in the UK. They use about 2,000 litres of helium. Inside an MR scanner that you go into, it's full of helium, liquid helium, and it's a very rare earth material. There's not a lot of it about, and it is running out fast. And again, as an idea, we have developed for the first time a low helium. So instead of 2,000 litres, 7 litres of helium. So again, completely transforming how much rare earth materials you put into product design. And when you think that 20% of the world's helium is consumed by MRI devices, you see the size of the impact you can do if you can fix things. So ecological design, and about replacing new products with more environmentally friendly and being more demanded by health systems to do so. And then the last bit on this story is around circular economy. And this is very much about when we put things into the health system, we should be absolutely held account to take it out as well. So again, when we put a scanner in, 15 years later, we should go and remove that scanner, and we should actually either refurbish and put it back in and reuse it again, or we should dismantle it for spare parts for the rest of the fleet, so that we can keep every part being used as much as possible, least to landfill. And it's those things which are really making a big impact, and I think we need to be held more to account.
Thank you for that, the circular model. And helium, who knew? So much helium was used in magnetic resonance machines. Really thank you for that. Peter, you've really worked closely with the Dutch Green Deal for Sustainable Healthcare. You're a committee member. I'd love to understand, how straightforward that process was. How did you come up with the 5 pillars and objectives around that? And what advice would you give other policymakers in Europe who are just on the first steps towards, creating a green plan for their country?
Well, thank you very much. Basically, the Green Deal Sustainable Care in the Netherlands is a sort of contract between the national government and the healthcare sector, which was signed in November last year, so 11 months ago, which indeed consists of 5 pillars. The shift from cure of disease to preservation of health. The second is create awareness, create research, but also involve the general public in this whole process. And the third is become carbon neutral in 2050. The fourth is about circularity, so reduce raw material use. And the fifth is about medication, so reduce the environmental impact of medication use. And altogether, there are about 50 or so more detailed ambitions. So that is the top-down activity, actually, in the Netherlands. And the whole sector has signed this deal. So that also creates...
It's voluntary, is it?
Yes, it is voluntary, indeed, but it also creates a sort of togetherness. So a joint effort. We, the sector, are going to do this together. And actually, that's quite good, I think.
Brilliant, thank you so much. And Elisa, so you've created this, or you've been part of this new organisation of, procurement professionals. So it's relatively young, 2019 you set it up. So, and excuse me for saying this, but will the procurement professionals be the rock stars, the linchpins in all of this, in this healthcare sustainability?
Well, thank you very much. I think that's a beautiful introduction, and I also consider that we achieved already part of our mission, me sitting here advocating actually for the importance of procurement in healthcare today. And are we there yet making procurement sexy as we can see it in other industry, and are we yet there in having procurement being rockstars? I must say we're not. We're absolutely not. But I think there is more awareness, first of all, from the procurement professionals themselves, that they can play a bigger role, that they should play a bigger role. But this is all tied to, I would say, uplifting skills, so from the bottom to the top, but also having commitment in from the C-level to actually make procurement a board decision and consider strategic procurement as a key element in everything that we're discussing here today. So how do we move from a procurement and purchasing lens? How do we move healthcare into way more sustainable health systems?
So your procurement professionals, what sort of roadmap do they use? What sort of sustainability criteria? Have you set a roadmap for them, or is it country by country? How does it work in practice?
It is very scattered, honestly, and I think this is what we can see across different European countries. In general, for the healthcare sector, we have different national guidelines. Of course, we have the EU going up front, but what we aim as an association to look into is trying to find the best practices out of the different countries, bringing that together, and also see how we can create more combined frameworks and blueprints to then also better collaborate with the industry by driving, I would say, more our demands from a procurement lens within healthcare, and actually saying what it is, what we want and what we need. Because I think not knowing and not understanding makes it also very difficult for the other side to actually come back with solutions. So with that being said, it's looking into first, I would say, making an internal analysis. Where are we? What do we need? And how do we get there? Also knowing all these different stages of where different countries and different hospitals are in regards to their sustainability actions. And then with that being clear, speaking out to the industry and making sure that we can collaboratively rather think in an ecosystem and in alliances versus one against the other in a very competitive mode. So that's our ambition and our aim. As you said, we're a young organization. We did start off actually before COVID, but COVID did show us so many things that actually were wrong, and that we took as a catalyzer to really make that happen.
Thank you for that, and I'm hearing collaboration, so critical. I'd like to shift the conversation to talk about plastic in the healthcare sector, because it's a really big problem. And in the UK, there's some really interesting case studies. Great Ormond Street has a great case study where they reduced non-sterile gloves from like 11 million to 3.7 million, and they saved a ton of money. So I'll start with you, Will. Mm-hmm. So this is a real issue, and healthcare professionals don't like it. Patients, I've spoken to patients who don't like it. So how are we going to deal with that?
It starts with measurement again, right? I mean, you've got to evaluate what the problem is. So we've been running some work with hospitals across Europe and developed some tools to help with that diagnostic process. So where are plastics being used? Where are they being overused? Where can they be replaced or reduced down? And so, yeah, that's where it starts. It starts with building awareness about where the problem is and what the alternatives is. And then from that, it's acceptance. So, I mean, I think you're right. I think a lot of healthcare professionals and patients particularly are concerned about this, but many are just unaware of the impact of things like PVC, for example, and the additives that go into that to make it, viable, in the medical industry, and the impact that those additives have on health. A lot of this stuff is still opaque. So, I think there's a job to do to actually raise awareness about that and the health impacts of these things, and it's the same with climate change, and that, I think, will drive a demand for safer alternatives.
Fantastic. And Peter, as a clinician yourself, and the amount of plastics you see in your own hospitals, I mean, what's the feeling on the ground with your healthcare professionals about this?
Well, obviously, plastics or disposable use is an enormous issue. And if you go into a hospital, probably operation theaters and ICU units are the most obvious first examples. And I think it starts with awareness, as you, I think, correctly mentioned, and then ask yourself, why are we doing what we are doing? And in many cases, the basis for that is rather thin or non-existing. And then ask yourself, well, could it be done in a different way, and try to find out, maybe with the industry, with the supplier of the materials, what a next step could be. And obviously then at a certain moment you come to the regulations on that. So there is also a task for the regulatory authorities to come into discussion in indeed why are we doing what we are doing? Is that really necessary? And that could be a complex process, but it's really necessary that we face that.
So taking that idea that patients are concerned about plastic and waste, and so I would like to kind of delve now into this idea of how can we unite people in this, and including patients in this. So yeah, I mean, who would like to start us on that? Yep.
Yeah, well, actually that I think is a very important point, because it's absolutely clear that this transition to a more sustainable healthcare sector is a huge thing. It's not legal, it is really huge. And it's only possible when the general population or the patient knows what we are doing or what we should do and what the part of the patient, the general population in this process is. So I think there is a great need for public campaigns explaining what actually is necessary to make the healthcare sector sustainable for our children and grandchildren.
And Elise, have you got anything to add? I mean, are procurement officers thinking about plastic and the way they purchase, or have they got a roadmap on this?
If there is a roadmap, I would doubt, honestly, but what I would say, and this is coming back to both of your points, it's a question of how can we substitute, what are good products out there, and that is coming back from me to the procurement profession and supporting the decision-making process and making sure that actually classification of products are clear. How can we compare products? How can we substitute products? What does it mean also in the discussion with stakeholders internally? The medical users, if that is physicians, if that is nurses, how can we improve procedures? How can we optimize certain workflows? And for me, that is the key angle of procurement, to be a part in it and to help actually that decision-making process together with internal stakeholders. And I must say I'm not seeing that so much today, that there is this involvement from a number point of view to how do we change products into the landscape in a hospital. And for that reason, I really want to advocate for looking into more diverse and interdisciplinary groups within hospitals to see what it is that we must change, how can we do that, and also ultimately, how can we financially create better and more sustainable models that actually allow us to transform into more sustainable healthcare organizations?
Great, that's really good, because that's the next question. So models of care, sustainable models of care, and that's a big area. AI, wearables, digitalization of healthcare, telemedicine, all this is going to play into it. Maybe I'll get to you, Mark, to start us off.
Yep.
How is that going to help us deal with these greenhouse gases, these new models of care?
Yeah, it's a fascinating question, and it's interesting because if we'd have been here 5 years ago, we'd have talked about sustainability as one meeting and digital as another, and they would not have been talked about in the same space. And I think what we're now starting to really understand is the potential for digital transformation of healthcare, which is critical, as we all know, in terms of addressing the healthcare capacity challenges of today and of the future, where we're just going to have unprecedented demand within a fairly closed system. We are going to need to unlock digital to support the capacity challenges, and by doing that, it will have so many side benefits around sustainability. So how do we enable more remote working? How do we help clinical staff work from home, can support patients around the country? And examples again being is, if you think about diagnostics, we are currently working through how do we connect up all of the scanners in the country together in a network so that you could be sitting in London helping remotely colleagues in the Outer Hebrides manage their scans on a daily basis without people travelling, without having to cancel appointments, and allowing patients to have care where they want without driving to hospitals, reducing their carbon footprint. allowing people to work differently, improving their mental health from a kind of a logistical point of view. And the other piece is all around AI, which terrifies people as a concept. But I think we talk about AI not so much as artificial intelligence, which has this concept of replacing clinical teams, but more augmented intelligence. And that's about how can you give clinicians augmented tools to help them do their work far more effectively and to actually manage their volume of demand coming into them with technical digital support. And I think that's the journey we're going on. And if I'm blunt, healthcare has not gone through a digital transformation yet. It hasn't started. And I think the next 10 years is going to be incredibly exciting and hopeful as to what we'll see come.
So, Will, I want you to also answer that question about new models of care, but I also want to ask you and add an extra question on top. How do we look at it from the equity lens as well, if you can?
If I can, okay. Well, first of all, it's so nice to hear Mark talking about it, because I was speaking at a conference in Berlin actually last year. It was a conference called DEMEA, which is about digital health, and I was speaking on a panel about sustainability. But even back then, it was still we were still talking about these are two separate things. Like, why? They're so complementary. And I mean, so I'll give an analogy. So the way I've been looking at, I've been working in sustainable healthcare as a practitioner now for 15 years or so, and I think most of the work that's been done is what I describe as end of pipe. So it's not a very good analogy, but if you imagine a factory making widgets, and there's that process creates emissions or impacts, and then you bolt some technology on the end, and that kind of deals with it. We've done our mitigation bit. It's kind of been the same in healthcare. We've not really actually asked, can we deliver care in a completely different way, in a way that is, will transform outcomes for patients, but also environmental outcomes. And that's very much about investing in public health. It's about health promotion. It's about use of technology and digital transformation. And that is, frankly, that's the conversation we need to be having now, not just for sustainability, but generally. So yes, completely agree. And I think, that's where we need to be headed, as a community working on this. To your other question, which was about
equity and digitalization, because not everyone can access this, and some, like the older patient, perhaps may not like telemedicine, for instance, and find it hard to use. I mean, how do we make sure we capture everyone, in an equitable manner? Yeah,
I'm kind of out of my depth on this one.
Go on.
But again, I think that's a really important topic in the sense that we need to enable the healthcare capabilities for those who need it in person to still be in person. But there is an enormous part of the population that will be happy to access healthcare differently, remotely, digitally. So it's about encouraging that new generation of people that actually think healthcare should be digital, to allow them to use it, to allow the population that need it face-to-face to still have that. So it's not about one size fits all, but it's about capacity and about using it for the right people at the right time in the right way.
Fantastic. Elsa, did you want to add anything about this?
I'm thinking about, what do we need in order to achieve this, right? And thinking about our different members, I believe we need a different way of thinking to actually allow more creativity and agility in regards to innovate certain processes. And even though I'm speaking here for procurement, but looking into, on one hand, how can we procure innovation better that actually fits the needs that we have identified? And that is a big challenge, to actually get the needs identified first, so that we have been hearing that about earlier. How do we get innovation in that is actually required to improve certain processes? And then on the other hand, how do we improve the existing processes in hospitals to create more data-driven decisions, to include more technology, to actually free people up from sitting in front of the screen, but really being available to the people that are the patients in that whole equation? I think that is a big transformation process that we still need to undergo, and that also requires our rethinking of how do we want to deliver health, and then does health not start, and we have heard that before, with a prevention mode. So with that all data we have available, I think there's a lot of work to be done in order to better understand that data that we have, and then to bridge that into all the different departments dealing with that data to take the right decisions out of it from all the very different aspects. And I think that is where we can still, if we're talking about digitalization in the healthcare sector, and particularly in the public sector in Europe, there is a lot of opportunity to improve.
Okay, thank you so much for that. Totally agree with all that. So one of the, in earlier sessions, one of the key stakeholders in all of this is healthcare professionals. And I'd like us to think about their carbon literacy. And I think a few days ago, someone came out with a really interesting a climate dictionary, which was fantastic. So, Will, I'll start with you. I mean, how do you rate efforts in Europe on this? And I mean, I know medical students at universities are calling for more teaching of planetary health and air pollution and climate change. It's changing, but on the ground, I mean, do we need to change CPD? I mean, what is the literacy at the moment? How would you rate it?
It's not great. I mean, it's good in pockets. So you tend to get these enthusiastic people who really care about it. And, you know, one of the techniques we found that works is if you can find those people and build support around them, then they can be kind of beacons of information and motivation within their institutions. We've got something called the Nurses Climate Challenge, which is just about doing just that. It's about supporting nurses with tools and resources so that they can train colleagues. We've got about 500 nurses in Europe kind of going through that program, and these are people who really care about this subject matter and want their colleagues to care about it too. But I think, so I think there's a lot more to be done, but I think that one of the key things here is getting boards of directors in hospitals to take this seriously, to understand the relationship between, you know, the environment and health, the role of hospitals and care workers in driving change. That's where I think actually a lot of the focus is, because there's so much flows from there. But yeah, more work to be done for sure.
Yeah, and obviously your organisation is doing great work in building these networks, which is going to boost this literacy. So Peter, carbon literacy, how would you rate it? What do we need to do to improve it? And what's the situation in the Netherlands?
Well, I think that's a very important subject, education. Basically, I think, personally, I think that education needs to start at kindergarten level. But if we focus on the medical education, the nice thing in the Netherlands, what you see is the sort of growing action from the students and the young professionals addressing the educational leadership. Hey guys, we are missing something in our educational system. So it's now gradually changing, or there is a start of a change. So let's put it like that. So there's still a lot of things that needs to be done, because basically it had to be done yesterday.
Yep.
And what you also see is on the level of specialty, so surgeons in their scientific organization and gynecologists, etc., address the subject on their particular field increasingly, and that is nice, I think, and very important as well.
Mark, as Philips is quite a net zero ideologue, I don't know if you want to say that. With interaction with the healthcare sector, will that help support that transformation in terms of literacy? Do you think? Because by showing what you're doing with your products, I mean, does that support it?
I think there's a number of things in there. I think that if you see what's happening at the moment, there is, if you look at young professionals, young healthcare professionals, 27% of them today will decide which hospital they work in based on the sustainability credentials of that hospital. So that 27% of young medical professionals already assess sustainability as a key criteria. So if you think about your population of young people, 27% of them want to be mobilised. They are waiting to be asked to do work projects and efforts around this. I think there is an awful lot of work around supporting the executive teams of hospitals to understand how to start the baselining. And I think that's where industry and the experts can help. Once the baseline is done, that first assessment of where do we start, how do we organise, I think then it's about mobilising the communities that you have that will actively get involved in that. And I can give an example at my company. We have a voluntary sustainability council. People volunteer to run as side projects. All of the sustainability things we do at work is driven by these people, and they are personally passionate about this subject matter, and they make a huge impact culturally through. So we sponsor from the top, but it's all done bottom up. And I think that's what we need to do. But where to start is the problem. And we need to help organisations just come over that first hurdle of that assessment. And once we do that, I think they go, is my perception.
I totally agree. We need green champions everywhere. And healthcare professionals are really keen on this. So you look at the surveys. I mean, we did a survey at Economist Impact, and they're quite keen to be involved in this, and so it's really important. Elisa, anything to add on carbon literacy? What the role procurement officers can play in local, economies, local healthcare economies? Before we open the floor to questions.
Of course. So I would agree that a strategy is very, very important to have it as a framework to then empower others to actually move within these guidance. And from a procurement side, what we're leveraging is that exchange across different countries within Europe and also the participation of Canada to actually share what they have been doing by setting up a team, sustainability, with very different backgrounds to share how they can improve that, but actually acting as one. Looking into how can we create sustainable criteria to bring that into tender processes with the ultimate goal of having sustainable contracts in place, and also fostering the dialogue with the industry, like seeing this is what we want to achieve, how can you help us doing that? Because this is how we as an organization, as an example, being a hospital, we want to drive our net zero agenda, and we need you, as you also mentioned for the Scope 3, to be a part of this. So what's our agenda, what's our plan, and how can we move that from a very strategic level into action-driven? And I would also highlight the importance of individuals, of really having the chance to take a shape in this, because I think this matters to all of us, and offering that safe space and that environment to contribute into whatever is coming to your mind. As I also would like to emphasize, it's not the most complicated things to start off with, but seeing really this is something we can change today and tomorrow, and then leading into a more strategic way of defining areas where change is needed.
I'm hearing change, yes. Change everywhere. So, panel, yes, our lovely audience. Now it's your opportunity to ask our panelists some questions, and I'm going to ask you to state your name and your affiliation, please, and and ask your question. So who would like to ask the first question? Okay, gentleman at the front here. Thank you. Oh, wait till the mic arrives.
I'm Dr. Kapoor. I'm one of the physicians at the Mayo Clinic in London. I'm interested in your comment, Mark, about the slow adoption of technology within the healthcare system. And I certainly see that in sort of primary care, particularly where we've got an ageing workforce that are not wanting to engage with digitalisation. How can companies like Philips help in terms of increasing the adoption of things like air ultrasound, which is a fantastic tool? How can how can you help in terms of doing that, in terms of improving confidence for the physician?
So it's a really good question, and I think for me the way I view it is there's multiple elements to that question, but fundamentally if you look at what's been available to now, it's been pocket digitization enablement. It's been put through traditional pilots and then put in locally into small regions. I think what you're going to start to see is we're going to start to see with the advancements of machine learning. You'll have seen it in ChatGPT this year, whether you like it or not. The ability to use machine learning now in terms of full-scale rollout is going to accelerate beyond all recognition. And what you're going to start to see then is the technology will become available. The bit that then industry needs to work with health systems is how do we put it out there at scale, and how do we manage the regulation and the risk? And I think what we're seeing in even the European AI bill that's being developed is really positive in terms of regulation, where we're starting to think about AI rather than in what can it do. It's a risk-based assessment. So you have to, when you deploy the AI, you have to say, what's the risk of this? Is it low risk, no risk, minimal risk? As long as it meets a low criteria, the speed of proliferation will be taken much faster. So I think our approach to digitization is going to change significantly. And I think that's when the education and the confidence of, from a UK point of view, working with NHS England head office, more than door knocking on every hospital around the country on these topics, needs to become far more the norm. And the bravery to roll these things out, because the capacity challenge is only going to, as we know, we've done a fantastic job for 75 years, but we are now creaking heavily, and the demand has not yet come. It is going to exponentially increase. So it is not an option. We are going to have to find a way as industry and health systems to find a much faster way of rolling out digitization.
Thank you for that. Anyone else would like to ask a question? Did I see? No hands? Gentleman at the back. Thank you. Thank you for the question. I didn't plant that one.
Hi, Ian Culligan, Head of Health and Environment at Bupa. Question for any of the panel really. So the session is called Racing to Decarbonise Healthcare. And I think a lot of what's been talked about are the long-term solutions. So the education of healthcare professionals, the digitalisation and so on. Like, we're in a race against time here. So I suppose, Will, you mentioned that the big hitters are energy in hospitals and supply chain. Do you think we're putting enough focus on those two areas that have a huge consumption from an emissions perspective? Or are we getting distracted by other things that are great long-term plays, but by the time we get a whole workforce advocating for climate issues, and we train med students who will be leaders in 15 years' time, it's going to be too late? Should the focus be a bit more around racing and accelerating as opposed to just doing things that we've heard for the last 3-4 years and there's not really been a change?
Do you want to take that, Will?
Yeah, no, I agree. I mean, sadly, the healthcare carbon footprint's increasing. So you're right. I mean, we're not doing enough, but that's a trend we see right across the economy. I mean, our big thing is find stuff that works, replicate it. We're a network building organisation, so I'm absolutely on board with that. And you've got to build a business case, and it comes back to the point about engaging, senior executives. This, the debate on this is over. All of the stuff we're talking about, the simple, relatively simple scope 1 and 2 stuff, the energy investment stuff, all of that pays back. The business case around that is absolutely clear. It was clear 10 years ago. It's clear now, right? So yeah, I completely agree. We've got to focus on that. We've got to get more healthcare institutions into that pipeline, doing that simple stuff. But in parallel, I think we do need to have these bigger conversations about, well, what are we going to do about Scope 3, because a lot of healthcare organisations, and I don't know what it's like in your world in Bupa, but really struggling. How do you even measure it? How do you even measure your Scope 3 emissions? And once you've measured it, what strategies can you deploy to actually influence emissions? So there are these big questions in the background, but the principle of your question is absolutely spot on. We've got to get more hospitals doing the basic stuff more quickly, and we're really invested in that.
Anyone else from the panel would like to answer that? No?
Well, I've answered a lot so far, but again, you would think industry would say not so fast, but actually I think there is a real urgency on this one now. If we put a new scanner in the system tomorrow that is not a more sustainable model, it's there for 15 years. 15 years, and we're stuck. So I lobbied last year when the NHS published their evergreen strategy and that 10% of procurement would now be based on sustainability measures. I argued it wasn't tough enough, which is strange from the provider side. But the idea that it's too soft, we need to be held to account, that we need to be more urgent on this topic. And I don't think there's any excuse that industry can't do this and be more effective. But it's that collaboration, it's the partnership of the two, and not buying and selling kind of principle. So we have to work as a team, but I think we have to be far more urgent than we are at the moment. We will lose a decade if we're not.
Lose a decade. The lady with the red top.
Well, maybe I can add to that.
Yes, go ahead.
Apart from long-term solutions, I think basically every healthcare worker has a task which starts today and tomorrow, and every healthcare worker knows best what her or his contribution can be, because he or she knows what he or she is doing in healthcare and what can be changed. There's so many low-hanging fruits which can be done tomorrow.
Yeah, the low-value care.
Yes. So parallel to the long-term solutions, there are all sorts of short-term activities which can start tomorrow.
Alongside retrofitting buildings.
Yes.
We have so many Victorian buildings here in the UK.
Many simple things.
Yep.
Yeah. So the lady, yes, please ask your question. State your name and affiliation first. Thanks.
Thank you. I'm Fiona Radshead. I chair the Sustainable Healthcare Coalition. And I think the panellists have mentioned patients as being important in terms of how we race to decarbonise healthcare. And I know that we know from economic analyses that the big untapped resource in healthcare are patients themselves. Unlike other sectors, we don't really engage them in their own care. We don't use them as a resource to help us manage healthcare. How can we use this race towards sustainability to actually fully engage patients as well as achieving our net zero goals?
That's a great question. And looking at clinical pathways, yes, who would like to answer that one?
Yeah, well, I very briefly touched upon that because that's also one of the objectives within this Green Deal. And so far, there in my country, we have only concluded that is a very difficult subject. Basically, you need a very high-level sort of marketing bureau to help us to explain to the population what is actually happening and what needs to happen in the next 5 or 10 years. Because the population is the most important stakeholder. And I have not a simple solution for that.
Would you like to add anything? A carbon clinical pathway, can we get that?
A carbon clinical pathway. I mean,
nothing's
impossible. Yeah, nothing's impossible. Let's dream big while doing the simple stuff at the same time. I agree. I mean, it's about it. It starts with awareness and education, I think, at all levels. But we're seeing the health impacts of climate change. I mean, I think one of the things about climate change, one of the issues has been it's this abstract issue that seems like it's going to happen to someone else, somewhere else at a different time, right? And that's just not the case now. It's happening today in Europe. In every country in Europe. To some degree, this is happening. It's impacting on people's lives. It's impacting on health, and I think there is some momentum building around this in the out in our communities, in the general population, and it's just for people working in health, that's an opportunity to really drive home the message that climate change is a health issue, it's a health emergency, and we all have a role. Everyone in this room can go and do something where they work to influence their workplace in a positive way. Just think about that. Everyone can do one thing to make one positive change where they work. Let's think about mobilizing that into a movement, and capitalize on that. So yeah, that's what I would say. Is it starts with us all just being aware of what's happening and taking action individually.
Yes, please.
And I think if we're thinking just of us as being people, being patients, being part of the population, I think it needs to be simple. Like, how can we move people with very simple messages? I think sometimes we overcomplicate things. I mean, you can just remember sitting last time in one of the hospitals or in the practice and the physicians are talking to you. That's not always easy to understand. So how can we make that conversation more eye to eye, more person to person? I think that would be very, very helpful. And then the question around behavioral change, I think we just need to look ourselves in the mirror. And I think how difficult is that? So how can we move very, very little steps with very simple messages and actually make it about the people and not so much make it about the healthcare system that then would drive the change, I would say, to actually be more as an accelerator to, and I like that word, do the change.
Yep, acceleration.
And can I just add one last thing?
Please,
and I think that the digitisation, the journey we're about to go on, if we link it up with patient choice, will be fascinating, because I think you will find most young people do not want to drive to a GP, sit and wait for an appointment. They will have a 5-minute call, do it online if they can, and they will think differently about consuming healthcare. So if we enable digital with the right demographic of population, I think we can transform care in the way the patients want to be cared for, but also removing capacity in a more sustainable way. It's the perfect Venn diagram. And I can give you the real personal example. I'm a heavy consumer of healthcare. I've got 3 children, 2 of which have got type 1 diabetes. So heavy users, wearing insulin pumps, glucose monitors. I get all of their data. We are very able to manage their condition at home. And yet every month we are asked to go in person for an appointment, drive to the hospital, use the car park, see the doctor. We don't need any of that care. So we constantly argue we don't want to come in, and we're dragged in against our will to have a meeting where we don't need it. And so again, it's that enabling people to be more flexible in how they consume care, freeing it up for the people that do. That for me that's the capacity, the sustainability. It's all of those topics in one piece, and we are about to, I think, really enter 5-10 years of real hopeful change. But if we get it right, I think it will be a fantastic journey. Bringing patient centricity with carbon clinical pathways, quite a challenge. Absolutely.
But great, thank you for that example. We have time for one question, a short one. Who would like to ask the last question? The gentleman at the front here.
Martin Sutton from Spire Healthcare. I just want to say the previous question is a lot better than this question. My question, I totally agree with Will around the challenges we have in identifying Scope 3 emissions, but common sense will say anything that's coming from an extractive industry is going to be where the concentration of carbon emissions is. So implants, plastics. So What are the panels seeing from those industries in terms of their steps they're taking to decarbonise?
Not me.
No, any takers? No.
Well,
Go on.
one aspect also, I think, is the thinking of the general population about what actually do we expect from the healthcare. Not all things that are possible need to be done. And that is a sort of mindset change that also needs to be accomplished in the coming years.
And maybe I would add to this. So if we would create more transparency about the product, and if we would be able to actually compare the products, adding in sustainable criteria, I think then we could make a good choice of, is that better product B than product A, and out of what reason? So that helps us actually to have a conversation around how can we do a better choice making for the patient then in particular.
Great, thank you. Thank you so much. That was a great discussion. Can we thank our panel? Thank you.